Okay, today we're going to talk about the across body stretch. Now this is a very important stretch to have in your repertoire, both as a physiotherapist, but also if you've got shoulder pain right now, it's a very important stretch to start to gently practice. And why it's so important is what it does is stretch out the back part of the shoulder. Now it's very common for this back part of your shoulder, the rotator cuff muscle and tendon group, for it to get tight. So it's very important to keep that muscle group nice and flexible, and the way to do it most effectively and easily is with this across body stretch. So that's what we're going to talk about today. The way to do it and how to get set up for it is most important. The big mistake that people make is they tend to pull the shoulder blade around with them as they do the stretch. What we're trying to do is actually stretch the tissue attached to the shoulder blade that comes out and grabs onto the arm bone. So if we stretch everything around, we're not going to maximize the stretch that we really want. So what we're trying to do is to keep the shoulder blade still, to splint it, and then stretch the arm off the shoulder blade to gently stretch those tissues that lie in between. I hope that makes sense, because it's really important that we get that and that you understand that fact. Okay, so I'll demonstrate how to do it. The big thing is to try to keep your shoulders in alignment. Keep the shoulder back and in line with your body. The arm comes up and the shoulder's still with me and my shoulder blade's still, and now I'm gently stretching the arm across my body in line out this way with my hand. I don't want to squash my chest. That really can impinge structures here at the front. What I want to do is stretch my arm across my body while keeping my shoulder blade in line with my body. So I'm effectively stretching those tissues that attach to the shoulder blade and keeping them nice and flexible. Now it's most important if you've got shoulder impingement or a fairly acute shoulder condition that you do this very gently. And in some patients and some clients it's very difficult to actually do, so it might not be the best time to start if your shoulder is quite painful. What we're trying to do here is gently load this tissue and gently stretch it. We don't want to overload it too early. So just be careful with it. You might have to adjust the arm angle here. A little bit lower initially might actually help, eventually coming a bit higher and making a more effective stretch. Another way to put a bit more pressure through it is to splint your shoulder blade against a wall. So if I come back against this wall here and I lean into the wall, I can hook my shoulder blade up into the wall. Now sometimes a door jamb is a great thing to use to help to splint that shoulder blade. Again, I'm keeping my shoulder blade still and I'm stretching my arm across my body to stretch those tissues that lie in between, which is the rotator cuff muscles and the rotator cuff tendons. So it's really important to get the technique down right. We really want to be effective with our stretching. Now in terms of the amount of sets or repetitions or time frames, there's no hard science. There's really no hard science to let us know what to do. Personally, I've found that 10 seconds is probably all I probably want to stretch for, and it takes a long time. It can take months to gradually build in flexibility. But when you first start, you want to do it very gently. I would probably suggest 3 to 5 repetitions of that stretch, 5 to 10 second hold, very gentle. We're just trying to make a small change in how the muscle tissue, the tone of that muscle tissue is lying there. We don't want it to be too stiff, we're gently trying to relax it. One way to help is certainly through stretching. And in fact, I've helped many a patient just with their shoulder pain just by stretching correctly and gently keeping these tissues flexible. So it's really important that you understand that. I really hope this has helped you. This across body stretch is something that you can do easily. It's fast. If you get the technique right, it can be so effective. Thank you very much for watching. My name's Luke, I'm the Shoulder Guy, and this has been another episode of Shoulder Guy TV. Bye for now.